So why do we brush our teeth? Well, we don't want to have bad breath. You get food off there. But the other thing is, I told you that there's good bacteria and bad bacteria. You are always going to have bacteria in your mouth, some kind of plaque in your mouth. As soon as you brush your teeth, some is still on there and it's going to stay on there. But what you're doing is you're controlling the amount of bacteria on to keep it below a level. So the way I'd liken it is, let's say you don't take a shower for 3 weeks. What's going to happen? Well, first you're going to lose all your friends, right? Mm-hmm. But the other thing is you're going to get some skin rashes and stuff like that. And the reason is that it's normal to have bacteria on your skin, but if you don't take it off periodically, it's going to start, bad bacteria start growing on there, and you're going to get a skin infection. Well, the same thing in your mouth. If you don't remove the extra bacteria that are there, you're going to have overgrowth. And I told you that term, dysbiosis. You're going to go from a healthy mouth with healthy bacteria to an unhealthy mouth with unhealthy bacteria. So how do you brush your teeth? First, let me say, from my practice, when I ask people how they brush their teeth, many people kind of knew it, but I suspect that most people brush their teeth by putting on the toothbrush and going no, and spitting, right? And so the problem with that is that you need more time to brush your teeth, and you have to be methodical about it. Again, going back to taking a shower, if you go in the shower and you put some soap over here, some soap over there, and soap over there, but not the rest of your body, you're missing a lot of your body, right? Well, your mouth is a complicated place. Your teeth, they have all these little bumps in the teeth, so they have an inside and outside. So the way to make sure you do a good job is by doing it methodically, doing it according to a pattern. So this is one way of doing it here, which is quite good. And by the way, you should be using a soft toothbrush. A hard toothbrush is not such a good idea because it'll actually wear your teeth out. And you don't need a hard toothbrush to take off plaque. But you go back and forth across the person's mouth, across your mouth, and to the other side. And then you're doing the inside, and then do the bottom, back and forth. So by doing that, and it sounds easy, but if you actually take the time to do it, it's going to take certainly over a minute to do it. When you're doing it on your client, and we'll talk about it later, you have to use the same kind of pattern. And I hope that you do this, for your own mouth. So same thing goes for the bottom teeth. So what you should do is, instead of just saying, okay, Mr. Jones, it's time for you to brush your teeth, you should say, okay, Mr. Jones, it's time for you to brush your teeth. And as he's brushing his teeth, maybe kind of watch how he's brushing his teeth. And so I give you permission to blame it on me. You could say, I went to this lecture the other day, and this doctor told me that, you need to do it in a pattern, so I think maybe why don't you try this? So what you're doing is you're educating your client. And I think you probably do that all the time, don't you? Don't you show people how to do things, right? So this is just changing that same pattern of how to take care of someone's body, but applying it to their mouths. And then give them some positive reinforcement, like good job. So here's two other situations. So these people can't really get up and use the bathroom. So what is this over here called? It's a Mrs. Pan, right? Yeah. So what you're doing is but this guy, he's able to brush his teeth. You're watching him brush your teeth. You're wearing gloves, so let him do it because he can do it. Yeah. So this woman over here has some cognitive problems, some dementia. She really can't brush her teeth, so you have to brush her teeth for her. And let me stop and say one thing: is that you all have a very difficult job, okay? And I think most people don't appreciate that because you're taking people who are vulnerable, they're at their most vulnerable, they're unhealthy. Sometimes they don't want you to help them, But as professionals, you have to be creative and figure out a way to do what needs to be done. So we'll talk about that. So here's a case where this woman is not able, so this person, wearing gloves, is brushing the teeth for her, using that same technique. Don't use too much toothpaste. So here's another situation, is both these women are not able to brush their own teeth, but they might have some trouble keeping their mouths open, but there are things you can do. In this case, you're brushing the teeth with one hand, and you're using the back of another toothbrush to keep the teeth apart, so you can get in there and do your job. And there's actually for sale. You can get them from drugstores or online. There are mouth props. So in this case, that's using to keep their mouth open, so you can do what needs to be done. Toothbrushes. So these are regular toothbrushes, but what has been done here is that the handles have been modified. So very often as people get older, they get some arthritis in their hands and they can't grasp something. But these are sold in drugstores, or you can get them online. You put the handle through this, and it makes it fatter, and it makes it so they can. They can also be done with eating utensils and stuff like that to help their grasp. And electric or power toothbrushes. I like them. Do any of you have automated toothbrushes? Yeah. So what's good about an automated toothbrush is that it goes back and forth or round and around. There are different types, and you place it in their mouth. Usually their mouth is kind of closed on it, and you just move it across the mouth. So instead of you doing that, it might be a little easier for them to have them just move it across their teeth, because it's rotating around, doing a good job. One thing you should know about automated toothbrushes is that you want to put the toothpaste on the toothbrush and don't start it. Wait till it goes in their mouth, because if you start it when it's out of their mouth, you're going to get covered with toothpaste. So put it on the toothbrush, put it in their mouth, and then kind of have them close their lips a little bit and then go around. So I think they're really excellent to use. And also, if they want to do it themselves, there's same kind of things that can help them hold it. There are even special toothbrushes that have two-sided toothbrushes. They get both sides at the same time, So that's something that, again, that you can find in drugstores or sold online. So you might, again, think, what would make this easier from this client? Maybe getting something like that, and tell, this is something you don't buy, their children or caretakers would buy. Well, the reason I'm showing you this is that, when you brush your teeth, it gets all the surfaces of your teeth, except it can't get in between your teeth. And in my practice, I used to see this a lot. And probably if some of you are getting some bleeding gums when you brush your teeth, it's probably because you're not flossing or getting something in between your teeth. About 40% of the area around your teeth occurs right in between your teeth. So if you're not, again, it's like not taking a good shower. If you're not cleaning in between your teeth, you're missing that part of your surface. And that picture I showed you before about the gum against the tooth, it's going to be inflamed right there. In my practice, when I looked at x-rays and saw bone loss, most of the bone loss was in between the teeth. So what you need to do is you need to floss, and your clients need to floss or something like it. Now, it can be difficult to floss your teeth or your client's teeth. So there are floss holders you can buy, which makes it easier to get in and out of there, and you've seen them in the drugstore. And you should be flossing once a day. If you see bleeding when you're flossing, keep flossing, and in about a week or so, you won't see any bleeding anymore, because your body can heal up that quickly. Also, toothpicks, and these are called stimulants, but there are things you can buy. You need to get something between your teeth every day, and sometimes if people can't floss, they don't have the manual dexterity, they don't like doing it, sit there, watch television, and use a toothpick between your teeth. You could also use these special little brushes, and some of your clients might have some of these brushes, or you might have some of these brushes. And what's good about this is that, particularly when you have some gum recession, you can get that between there, and that's like, it's just like brushing in between your teeth. So that's something that can work out well also. And you need to clean your tongue. You do, yeah. Why? Because your tongue is, as you see over here, it's full of this bacteria and plaque and stuff like that. And the way to clean it, there's special brushes you can use. What I do is I stick my tongue out, I hold my breath, and I brush it with my electric brush. When you first start doing it, you might gag a little bit, but it's kind of like you get used to it after a while, and then you won't gag. With your clients, they should be brushing their own tongue, or you can help them brush their tongue. And then there are all sorts of devices in the drugstore you can get to do that.